Hello, it is possible to lower your blood pressure naturally. Yes, it is true. There are many scientific studies that demonstrate this. Therefore, if you suffer from hypertension or are concerned about it, here are some common questions that people often ask. Can stress or emotions cause high blood pressure? Can eating healthy and exercising prevent hypertension? How do I check my blood pressure? And when should I see a doctor?
I am 57. It all hurts now.
Hey there, and welcome to my channel. My name is David, and I'm here to share some super useful health tips with you, especially if you're over 50. Now let's talk about hypertension. It's normal to wonder if stress or emotions can cause high blood pressure. But the truth is, high blood pressure usually doesn't have many symptoms, and if it does, they're usually not specific. That's why it's so essential for everyone to check their blood pressure at least once every 5 years. If yours is less than 120/80, you can continue to check it every 5 years. If you don't have hypertension, that's great. But if your blood pressure is a little higher, like less than 130/85, you should check it more often, like every 3 years. And if it's a little higher but less than 140/90, you should check it at least once a year because you might develop hypertension soon. Some people think that if your blood pressure is above 130/85 but below 140/90, you already have hypertension. But other guidelines say that if you have more than 140/90, you have hypertension. This discussion will divide high blood pressure into two types: arterial hypertension and transient hypertension. Arterial hypertension is a chronic condition in which blood pressure remains elevated for an extended period of time and requires medical treatment. Transient hypertension is temporary hypertension that occurs during physical activity or emotional stress and doesn't require medical treatment. However, it's important to monitor transient hypertension, as it can sometimes be a sign of developing arterial hypertension. It's normal for blood pressure to increase during physical activity, such as going for a run or a fast walk, or during times of emotional stress. This is called transient hypertension and is caused by external factors. It's important to properly control arterial hypertension, as it can have serious health consequences if left untreated. High blood pressure can damage your arteries, including those in your brain and kidney. So we may ask ourselves, am I hypertensive or not? You're hypertensive if you have consistently high blood pressure above 140/90. On the other hand, if your average blood pressure is usually around 110/80, 120/80, or 130/85, it increases when you are sad, nervous, exercising, or drinking coffee and then returns to normal. You are not hypertensive. Instead, what you see is a normal response of your heart to stress. In this case, your heart is functioning well. This is why in studies, patients are asked to take their blood pressure and record it for 5 to 7 days using a device that takes it multiple times. Even though temporary high blood pressure is not a severe issue, it's crucial to check it regularly to ensure it does not become a long-term problem. Another question is whether we need medication or can control high blood pressure with our diet. Changing our habits can help control and even treat blood pressure. Now, I'm not just saying that in this video. The most prestigious and frequently consulted cardiology guidelines say it too. If you really have high blood pressure and you're a poorly controlled high-risk diabetic patient or have had a heart attack, a diet alone may not be enough to manage your risk. In that case, you'll need medication. But what diet will allow me to reduce or improve my blood pressure? Well, the first piece of advice is to use fresh foods. If you have seen my previous videos, I talked about this topic. Sodium increases blood pressure by causing kidney changes and interacting with some molecules predisposing to high blood pressure. Believe it or not, most of the salt we consume in our diet, even if it's excessive, doesn't come from the salt shaker. Instead, 70% comes from non-fresh foods. Here's a list of foods that contain excessive sodium: bread, pizza, broths, instant soup, processed meats, canned olives, and grated cheese. For example, a single serving of bread can contain 30 to 40% of the sodium you need to consume in a day, and a little grated cheese that you put on your favorite food can contain up to 100% of the salt you don't need to consume in a day. That's why you'll likely reduce most of the sodium you're consuming if you use fresh foods. Another significant point is potassium. It is known that consuming foods rich in potassium, such as bananas, sweet potatoes, beans, fish, broccoli, oranges, tomatoes, and spinach, is related to a decrease in blood pressure because it relieves pressure in the blood vessels and helps eliminate sodium. But be careful if you have kidney problems, as these foods are unsuitable. What about fat? Bad fats, like those found in fatty and processed meats, can increase blood pressure. Studies have shown that regularly consuming these foods, such as processed and fatty red meats, can increase your risk of high blood pressure by 10% to 20%. This risk is not only due to the high sodium content in these foods, but also because they can increase the likelihood of a heart attack, stroke, and kidney damage. So it's essential to be mindful of how much salt you consume. Eating a diet rich in fresh foods can significantly reduce the amount of sodium you take in. Table salt comprises 60% chloride and 40% sodium and is often fortified. It's recommended to consume no more than a quarter or third of a teaspoon of table salt per day and to keep the salt shaker off the table. The Mediterranean diet is effective in reducing blood pressure. This diet involves limiting the intake of fatty red meats and choosing lean cuts, increasing consumption of white meats and fish, increasing the intake of whole grains, fruits, and vegetables, and replacing bad fats with good fats like olive oil and nuts. How can I tell if I'm hypertensive at home? The first thing you should know is how to take blood pressure correctly. The cuff should be for the arm, preferably not so much for the wrists, as it tends to give higher values. In addition, you must make sure that the cuff is validated for taking blood pressure. You should be seated with your arm at heart level to relieve the pressure for 3 to 5 minutes. Sitting down immediately after running down the stairs is not helpful, as your heart would send blood to your muscles and you could not accurately diagnose your blood pressure. You must also ensure that your legs are not crossed, that you are not talking, and that you have not had more than one coffee or smoked before taking the pressure. A common question is whether measuring blood pressure in the left or right arm is better. The left arm generally tends to have a few millimeters more pressure, but not much. This is because the heart is closer to the left side, so that you may find higher readings there. However, it is essential to note that measuring in the same arm must be done consistently. Keep track of your readings and how you felt on that particular day, especially if you had a disagreement, a headache, or a bad day. This will help your doctor understand if your high blood pressure is due to a medical condition or if it's due to an external factor, such as stress. When should you go to the emergency room for high blood pressure? You should go to the emergency room if your blood pressure is very high, mainly over 180 over 110. It's also a problem if you're a hypertensive patient who didn't take their medication that day and your blood pressure is high. In this case, you'll just be medicated and sent home. If you're hypertensive, didn't take your medication, had a lot of salt that day, or were stressed, your blood pressure may be high. In this case, you should see your cardiologist, adjust your medication, and follow it. If you got a severe headache, chest pain, difficulty breathing, swollen legs or face, or are pregnant, you should go to the emergency room. These are alarming signs of high blood pressure. Can you exercise if you're hypertensive? In general, yes. Physical activity is recommended for hypertensive patients as long as it's moderate and doesn't cause a significant increase in heart rate. It's essential to consult with your doctor before starting an exercise program. In some cases, certain activities may be contraindicated, such as contact sports or activities that involve a lot of jumping. The key is to find an activity that you enjoy and that doesn't cause significant strain on your heart.